Hi, my name is Shane Zumbrunnan. I'm an occupational therapist and certified hand therapist, as well as an owner of a private practice therapy clinic. We want you to keep in mind that you only have to test positive for one of the assessments in this series. You do not have to have all of the tests test positive in order for you to benefit from the kits that we have available to you. So let's do these tests together, pay close attention to your pain, and let's get started. There are two types of tendinitis that commonly occur in the elbow. The first is called lateral epicondylitis, or tennis elbow. It occurs on the outside portion of the elbow. The second is called medial epicondylitis, or golfer's elbow, and occurs on the inside of the elbow. We'll first review the tests and symptoms of lateral epicondylitis, and then follow with medial epicondylitis. The most common elbow tendinitis is tennis elbow. To locate the area of pain for tennis elbow, you will want to find the bone on the outside corner of your elbow. You will move down approximately 1 inch and put pressure in this area. If you have pain with that level of touch and palpation, that is an indicator that you likely have elbow tendinitis. Other situations and symptoms that may lead you to a diagnosis of lateral epicondylitis or tennis elbow would be pain with holding a jar or an item palm down, especially with your elbow fully straight. This will typically elicit pain on the outer portion of your elbow and give you a positive indicator for tennis elbow. Besides tenderness with pain and pain with activity, there are a few tests that we use to commonly diagnose tennis elbow. The first one will be to bend the wrist back while keeping the elbow straight. It's best to have somebody assist you with this and support under your elbow. They will come and put gentle pressure on the back of your wrist while you resist that movement. While you're holding that, if you have pain on the outside portion of your elbow, that is a positive test. The second test is the middle finger test. You will again bring the wrist back, keep the elbow straight, and only push on the back of the middle finger. If this test causes pain on the outside portion of the elbow, this again is a positive indicator that you might have tennis elbow. The last test is a stretch test. You will again keep the elbow straight and have your assistant bend your fingers into a fist while bending your wrist in a downward motion. You will move this until you feel a stretch, but if you have sharp pain at the end of this stretch, that again is a positive test for tennis elbow. The second type of elbow tendinitis is called golfer's elbow. To locate this area, you will find the bone on the inside of your elbow. You will then move down approximately 1 inch. You will then apply pressure and move your finger throughout the area. If you have pain with this motion and with this pressure, that is an indicator that you likely have golfer's elbow. Other indicators and symptoms that you may experience is pain with fully straightening your elbow. This will oftentimes cause you to have discomfort right in this same area around that bony point on the inside of the elbow. People will frequently have discomfort as well with formation of a fist, especially a forceful fist while using tools. Other than pain that you may experience with palpation just down from that bony point, the primary test that we use to diagnose golfer's elbow is a stretch. You will simply straighten the elbow fully, turn your palm up, and have an assistant apply pressure in a downward fashion. If this causes you pain and discomfort on the inside portion of your elbow, that would be a positive test for golfer's elbow. A diagnosis that's commonly mistaken for golfer's elbow is cubital tunnel syndrome. This is irritation and compression of a nerve that lies in the area that we commonly call our funny bone. This nerve is called the ulnar nerve, and if you tap in this area, right underneath in the groove, you will experience shooting sensations throughout your forearm. If you experience those, you may not have golfer's elbow, you may have something called cubital tunnel syndrome. Be sure to differentiate between these two diagnoses so that you treat them appropriately. If you tested positive with any one of these tests, go to hometherapysolution.com before your symptoms worsen and order your kit today.